Oh. Okay, whenever you're ready, Dustin.
Are you gonna, do you want to do an introduction first, or you just gonna?
Just go ahead and introduce yourself and talk about
Okay.
what you're going to do.
All right. Good afternoon or morning, depending on when you're watching this video. My name is Dustin Etheridge, also known as Mr. Health Insurance, aka Mr. Healthcare. I'm here today with Jeannie Burris from the downtown Central Arkansas Library System, and we're going to be talking about Medicare Basics. We're going to be reviewing the basic information about Medicare because it is that season. It's that time of year when your mailbox gets flooded with promotional items, with lots of confusing information, with a big thick book from Medicare that very few people read. But we're going to talk about not only the basics of Medicare, which affect everyone that's on Medicare and those entering Medicare, but we're also going to be talking about some specific changes and dynamics that are happening in Central Arkansas, as well as some tips and tricks at the very end to help you maximize your Medicare experience. I want to start by thanking CALS for having me again. We've done these a few times at library locations in the past years, over the last several years, but obviously because of the pandemic, we are now doing these live, which is exciting because they're also recorded so you can actually share this link with your friends and family. I want to start off by sharing a flyer with you, and this is just a document that we use, or I use when I do these classes to help people understand a little bit more about Medicare and the dynamics of Medicare. And I'll make this a little bit easier for people to see by changing the screen size without making it too difficult to read. So we're going to start here with, what are your Medicare choices? Now, there's a lot of confusion out there about Medicare, but when you enter Medicare, you basically end up with a choice of A and B. Hospital is Part A, medical is Part B. Now, hospital is automatic. It starts at age 65 or 2 years after you've been on disability. You cannot turn it off. It does not cost you anything. However, Part B does have a monthly premium, and that monthly premium for the year 2020 is $144 and change. That premium is deducted directly out of your Social Security check, or if you are not taking Social Security, it will be deducted from your, you'll have to make payment arrangements to have it deducted from your checking account or from a credit card. And you oftentimes do have to pay that quarterly if you're not having it taken out of your Social Security benefits directly. Now, the issue with Medicare Part A and Part B is that it is not 100% coverage. And that's a lot of the confusion out there. Part A has deductibles and some co-pays if you're hospitalized. Also, Part B only covers 80%. That leaves you responsible for 20% of a hospital bill with no maximum. So there's no limit on how much your 20% could cost you. And that's one of the major challenges that a lot of people do not aware of, and they don't know it, and they don't have a chance to protect themselves from the cost of an out of control medical bill. And just keep in mind, it is very easy in 2020 to rack up $50,000 outpatient procedure bill or $100,000 1 or 2 nights in the hospital. So make sure that you are working with a local agent, someone who specializes in Medicare, not just somebody who does it at the end of the year because it's convenient, but you want to make sure you're working with somebody who specializes in Medicare, works with all of the companies available in your market, not just 1 or 2, and can help you protect yourself from those unexpected expenses. Now, the left-hand side of your page, Original Medicare, you've got A and B as the first SAC. The second SAC is your prescription drug coverage, also known as a prescription drug plan or a PDP. Now, that is something that you're going to want to have because that's how you pay for medicine. See, Medicare doesn't pay for medicine unless you're hospitalized. So if you're not hospitalized, Medicare is not going to pay for your medicine. Also, you have to have a prescription drug coverage or credible coverage through an employer group plan or through the Veterans Administration. Those are the two most common. Cobra is not credible coverage. So you want to make sure you have credible coverage and or a prescription drug plan. If you go more than 60 to 63 days without a prescription drug coverage, you will begin to incur a drug plan penalty that will be assessed and added to your monthly premium for your drug plan once you pick a drug plan. So make sure you are on a drug plan. And we'll talk more about some of the tips and tricks about drug plans at the end of our presentation. Additional coverage, the third SAC represents your, we're going to scroll down here, this third paragraph down here. These are your true supplemental insurance plans, oftentimes called Medigap or Medipack. These are plans, they're A through N. Most popular plans are F, G, and the letter N as in Nancy. So you have F for Frank, G for good, and N for nurse. Those are plans that usually have premiums that start somewhere in a $150 range and can easily go up to $250 depending on the plan and the company. All the plans are exactly the same. Some offer some fringe benefits like a gym membership or some discount vision, but ultimately what they cover is controlled and dictated by Medicare, and they offer almost 100% or 100% coverage of everything Medicare doesn't cover. So if you're on a true Medigap plan, and please understand that an Advantage plan on the right-hand side of the page is not a supplemental plan. The Medigap plans, and you know if you're on one because it costs a lot of money, it's being deducted out of your checking account every month or you're paying the bill every month. Those are the true 100% coverage or almost 100% coverage plans that are available to folks. Now you do have to be over 65 to get on those plans. So our friends who are under 65 do not have the option of getting on those plans. So something to be aware of. Now the vast majority of our Kansans end up on the right-hand side of the page on a Medicare Advantage. Another way to think about this is the left-hand side is your Cadillac and the right-hand side is your Chevrolet. Medicare Advantage plans are contracted programs that Medicare has with private insurance companies, all the big names, they're showing up in your mailbox, and they must provide the same coverage that original Medicare provides. These plans do not replace Medicare. These plans become primary and Medicare is secondary. These plans also offer prescription drug coverage. Most of them do, some of them don't. So make sure you know if the one you're choosing does or doesn't. And they can offer additional benefits like vision, dental coverage. They can also help with transportation. They can help with meals. They can help with over-the-counter products. They can also help with the gym membership. They can help with smoking cessation programs. A lot of them provide the help I've fallen, I can't get up buttons. There's lots of things that these programs can add to your benefit structure over and above the bare minimum of Medicare. But these, again, do not replace Medicare. These become primary and Medicare is secondary. These plans, you still have to pay your Medicare Part B premium. And these plans start as low as $0 monthly premium and can be well over $100 a month, depending on the plan you choose. The vast majority of our Kansans have one or more $0 premium plans to choose from. And this coming year, during this open enrollment period, we have several very, very attractive plans in the market. So let me come back. I'm going to turn off my share and come back to my beautiful face. Hello. And we're going to talk a little bit more about some details about our local market And because of Medicare restrictions and Medicare rules, I'm not allowed to say some things. I'm not going to be able to call out any particular name or particular company because of the Medicare rules. But I want you to be aware that there is a major company in the market that is no longer in network with Baptist or St. Vincent's. So you want to make sure that if you're with that company, that you are seeing a local professional to help you with making those changes. Also note that insurance agents are not allowed, nor will they charge you a fee for reviewing your plans. It's illegal, it's unethical, and frankly, it's completely unnecessary. So don't be afraid to work with a local licensed professional. Now, there are some organizations in the area that have volunteers who are trained a little bit, but they're not licensed agents. They don't go through about 100 hours of training every year that I, as a licensed agent, and other licensed agents have to go through in order to offer these plans. Also this year, there have been a couple of new plans introduced that are offering more dental coverage. However, they do have co-pays. So again, there's no 100% dental unless you're on 100% Medicaid. But there are some new plans in the area that are offering more dental dollars, but they do have co-pays. You want to make sure you understand the difference between being on an HMO versus a PPO and understanding the difference in the networks that are involved. And you also want to make sure that you're getting all of your fringe benefits that you need. So if you're not 100% sure, I encourage you to reach out to a local agent. I have an office in Sherwood. I also have an office in West Little Rock, and I travel throughout all of Central Arkansas. And every agent in the area is ready to talk to you by phone or by video or in person with proper protocol and face mask and so forth. We're here to help you. You have until December 7th, from October 15th until December 7th to make changes. After December 7th, the changes you make, you may be permanently stuck with for all of next year. Now, if you do make a change during this open enrollment period that you decide in January that you don't really like the new plan, please contact your local agent because you may qualify to make one more change in the first 3 months of the year, January, February, or March, to a different plan. And you want to make sure you exercise that right. So let's talk a little bit about some tips and tricks regarding prescription drug plans. There is a new prescription drug plan that's going to be coming on the market. It's a national program. The monthly premium is less than $10 a month. However, read the fine print. The drug deductible, which is over $400 for the year, starts on tier 2 medicines. A lot of people are on tier 2 medicines and don't realize it. When you are looking at drug coverage and when you are looking at saving money, please work with a professional who understands and has the software to enter your drugs and help you find not just the least expensive monthly premium, but also your lowest total annual out-of-pocket expenses. Those low premiums can end up costing you a lot more money down the road if you end up on the wrong drugs or start on the wrong drugs. And a prescription drug plan is one of those things you cannot change after December 7th. So please make sure you're working with a professional and you are looking at all of your options, because no two drug plans are the same and no two drug plans are going to save you the same amount of money. So please make sure you're working with a professional. One of the things that I like to help my clients do is we will look at the drugs they're taking. And if you're taking a tier 3 drug, and if you're on Medicare, you understand that there are 5 tiers of prescription drug coverage. and 1 and 2 are your cheap ones. But that third one is where the dollars can start to add up, and tier 4 and 5 are really expensive drugs. A lot of the drugs you see advertised on television are tier 3 or tier 4 drugs. So you want to make sure that you're giving all of your drugs to your insurance professional and they're able to analyze them. One of the tips I'll give you is if you have a tier 3 drug that you can purchase with a program like GoodRx or any other discount type of program that you can have at no cost in addition to your drug plan. That's right, folks. You can use multiple ways to get your drugs. You can pay cash because there's a cash price at almost every pharmacy. You can use your insurance card, or you can use a discount program. The discount programs don't have deductibles. So if you're on a tier 3 drug, you can get that drug at the same copay as your drug plan, but no deductible. And that's another way that you can save yourself over $400 a year on your out-of-pocket expenses. Another thing you can do is you can also call Medicare. You yourself can call Medicare direct and let them know that you're on an expensive drug and that you need help getting that drug reclassified or getting what's called a tier exemption. And that will give you a prior authorization. Those are the key phrases: tier exemption and prior authorization. And that will help bring that drug from a tier 3 down to a tier 2 and can help reduce your expenses as well. The other thing that you may have to do is work with your doctor to set up a step therapy program that your doctor basically works with Medicare rules to help Medicare understand that the drug you're taking cannot be replaced with a generic, and therefore they can make an exception and reclassify that drug also. Also, you want to make sure that you know that the doctors you're going to go see, or the eye doctor or the dentist, whoever it is you're going to go see, I highly recommend that you always call the insurance company first and ask, is this doctor still in network? Still, yes, my friends, doctors can drop insurance companies anytime they want. Hospitals can drop insurance companies anytime they want. So twice this year, a lot of local Arkansans woke up one day and discovered that they could not go to one of the 2 biggest hospitals in Little Rock or Central Arkansas because those hospitals dropped one particular insurance company. So please make sure you contact a trusted insurance representative that specializes in Medicare to help you manage the Medicare maze. And now I will open up our meeting for questions. Have any questions been submitted, Jeannie?
No, we don't have any questions submitted, but I had a question.
Sure.
So for people who are 65 but are still working and they have health insurance through their job, you said that at 65 Medicare started automatically. How does that work if you have coverage on your job?
That's a great question. I'm so glad you asked. If you have coverage at work through your own employment or your spouse's, your employer coverage plan, about half the time, about 50% of the time, is as good or better than your Medicare options. And you can elect not to start Part B. Part A will just sit there, kind of dormant, doesn't really do anything. But you're going to be able to not turn on Part B or turn Part B off before you turn 65 and stay on the employer coverage. But again, half the time, Medicare and its private insurance options are actually a better value, not only in monthly premium, but also because of deductibles and max out of pocket. So one of the things a lot of people don't think about their plans at work is they know, or they think they know, what the premium is. And sometimes the spousal premium can be a lot higher than the person who's employed. So a lot of times I'll work with a family and we pull the spouse who's turning 65 off of the group plan, but leave the employed person on the group plan. So you can do that. And by the way, you don't have to wait for the annual enrollment of that group plan. You can do this at any time because of the Medicare loophole. But the thing a lot of people get surprised by is a insurance term called max out of pocket. So we're all real familiar with what a deductible is, but we're not real familiar with what a max out of pocket is. To make it real simple, let's say you end up in the hospital for a night or two and your bill is $50,000. You're gonna have to pay your deductible. The average deductible on a group plan in Central Arkansas is about $5,000. So you have to pay the hospital $5,000 before your insurance company starts to pay. After you've paid $5,000, the insurance company starts to pay, but they only pay 80% on average until you spend another $5,000 for a total max out of pocket of $10,000. That's why the vast majority of bankruptcies are medically related, because people are not expecting or aware of their max out of pocket. However, in Medicare, deductibles are a lot lower, sometimes zero, and the max out of pocket is always lower. So you want to investigate that and look at the math, because it's frankly just about the math, and know what you are dealing with. One of the things I do, I work with a lot of financial advisors helping their clients protect assets, and we use Medicare programs to protect assets. So good question, Jeannie. Do you have any others?
Yes. So on the chart that you had on the screen earlier, you were showing there was on the left and right hand side, and you said the one on the left was like the Cadillac and the other one was like a Chevy. Do you have any idea of just some figures, the difference in cost between Medicare and then the Medicare Advantage?
Well, it totally depends on the plans, and there are too many variables to throw out numbers. Bottom line, on the Cadillac side, if you're on a Medigap plan, your monthly premiums are higher than they are on the other side with the Chevrolet. However, if you land in a doctor's office on the Chevrolet, you're going to have little to no out of pocket. On the Chevrolet, you're going to have some out of pocket expenses, but on the Cadillac side, you're going to have little to no out of pocket expenses. So it's kind of like that old saying, pay me now or pay me later. When it comes to medical insurance that works with Medicare, it's the same thing. You can pay for a premium, to have deluxe Cadillac coverage, and know that when you show up at a doctor or hospital, you're going to have little to no out of pocket, or you can keep your money, go on an Advantage plan or a Chevrolet, and know that you're not paying anything now, but when you do go to the doctor, you are going to have to pay something depending on what type of doctor it is or what the situation is. And even a lot of those Advantage plans have zero copay to see your primary care doctor, or offer free video doctor visits as well. It's not really until you start seeing a specialist or land up in the hospital or end up with a medical procedure that you're going to start having copays. That's why it's important when we sit down with clients, we understand what their economic situation is. A lot of our Kansans qualify for state and federal programs that would help reduce or eliminate their copays, and I can help them figure that out. And then we can also talk about the local hospital programs that are internal that can also help people. All Arkansans that are low income that don't qualify for state or federal assistance, every local hospital has their own internal program that you absolutely need to ask to be signed up for. And that can help also reduce or eliminate your deductible or max out of pocket expenses.
Sure. One other question I had was, you mentioned that some people, if they don't plan ahead, that they can get caught off guard and wind up with an astronomical hospital bill resulting in, like maybe a medical bankruptcy. Will hospitals allow people to, set up some kind of a payment plan or something where they can make monthly payments so that they don't have to file a bankruptcy? Or do you have any idea how that works?
most of your hospitals, Jeannie, that's another good question. And it's something that we're running into more and more all the time. Most of your local hospitals will do payment programs. Most of your local medical providers will not.
Mm-hmm.
And one of the things I encourage my clients is if you're going to have an outpatient procedure, go to a hospital facility to have that done. Because when you go to a private office facility to have that procedure done, you're not likely to be offered any low-income assistance, nor will you be offered any payment programs. So you definitely want to make sure you're working with one of the big hospitals in your county, that hospital has a low-income program that the vast majority of Arkansans qualify for.
Mm-hmm.
And regardless of your Medicare standing or if you're under 65, there is assistance, but you have to really know and understand how to do it. For example, an MRI, you can go to the hospital and get an MRI and be on their discount program and pay a lot less for the MRI. But if you go to a private MRI facility, they most likely don't offer a discount program, and you're going to end up paying 100% of that MRI expense that's not covered by your insurance.
Wow, that's great. And I think that's probably the opposite of what most people think. Most people probably think it's better to go to a local facility, or if their doctor has the capability to do it within their office, most people would think that would be the way to go instead of going to a hospital. So that's great that you clarified that. I can't think of any other questions. Your contact information is on the screen behind you, right? So
Yes.
People can contact you, and you said that there is no fee for a consultation with you, correct?
Correct. Myself nor any other local agent. I have 5 other agents in my office in Sherwood that are more than happy to meet with folks. We are available during October and November, and the first part of December. We're available 24/7, 7 days a week. We are seeing clients every day of the week, early morning, late night, whatever we need to do to see people and help people. But you can also talk, if you already work with a local agent, check with them as well. If you already have homeowners or car insurance, check and see if they do Medicare. They may or may not. But I always recommend getting a second opinion, and just keep in mind that there are a lot of companies out there offering these programs, and you need to make sure you're looking at all of the options and not just one company's options. And remember that a lot of agents out there are restricted to just representing one company.
Right.
And I want people to understand that there's a lot of options, a lot of plans, a lot of companies. Please make yourself aware of all of them, because there is no one size fits all in health insurance.
Right. So it sounds like people, rather than talking to a private agent, would be better served to speak with somebody like you, who is objective. You're not representing a specific company. And so you've got the objectivity to really step back and look at all the options and recommend what's best for each one of your clients.
Not only that, Jeannie, and that's a great point, but I also want people to understand that we all get paid the same no matter what company or plan you choose.
Mm-hmm.
Medicare controls everything in our industry. So it doesn't matter to the agent what company you pick. The agent gets paid the same by the insurance company because it's all controlled by Medicare. So there's no reason for me to lean towards one company or another company, or one plan versus another plan, because I don't have an economic reason to do that. My purpose and my focus is making sure that your economic best interest is represented, and that I'm trying to find ways for you to save as much money as possible and gain as much as you can in benefits, services, and asset protection.
Right. Well, Dustin, I surely thank you for this informative program that you've done for us today. Do you have anything else to add in closing, or any other final thoughts or comments?
You don't know what you don't know, and that's okay. That's why all I do is Medicare. And there's a lot of agents out there just like me. Work with an agent, a licensed individual agent who's independently contracted with multiple companies, because you don't know what you don't know. We have spent the last 3 months going through over 100 hours of education to get ready for the next 3 months and all of next year. Please ask questions. There are no dumb questions. You don't know what you don't know. We do, and we are here to help you. And you're the most important reason we're in this business, is to help you maximize your Medicare.
Well, Dustin, we are surely thankful for people like you who can help the average layperson navigate these waters that are just can be so confusing and so complicated. So we thank you for taking the time to present this program with us today. And for those who were not able to come and view it live, we will have this available on the COWS YouTube channel. And so I think it's going to end up getting a lot of views, because this is a program that a lot of people do not understand. And I think it's going to be a very informative session. So we thank you for your time and hope you have a great day, Dustin. Thanks.
Thank you, Jeannie. Have a good day.
You too.
Bye-bye.
Bye.